What are dental crowns and how do they work? A dental crown is a protective cap for your teeth. Over time, as your teeth wear and tear, a dental crown can restore the form, function, and aesthetics of your teeth. Crowning a tooth will help it to last longer and to prevent further damage. What are the different types of dental crowns? In general, dental crowns can be made out of different materials such as zirconia, porcelain, lithium disilicate, and metal. At Vivid Prosthodontics, we tend to use zirconia due to its fracture resistance, enhanced aesthetics, and biocompatibility. How long do dental crowns last? Dental crowns are a long-term solution to restore teeth. In general, they can last between 10 to 20 years with proper care. Various factors can affect the dental crowns, such as temperature changes and chewing function, which can cause wear and tear. On occasion, cavities can occur around the crown margins. In order to maximize the lifespan of your crowns, it is important to maintain good oral hygiene and to have regular professional cleanings and checkups completed. Protecting your crowns with a night guard can also help to significantly extend the longevity of your restorations. Do dental crowns hurt? Any discomfort from the preparation of the teeth to the insertion of the crown is usually mild. At the time of preparation of the tooth or insertion of the crown, local anesthetic is used to provide our patients with comfort. After these procedures, while many patients do not require any analgesics, it is possible to use Tylenol or ibuprofen if required. What is the downside of getting a dental crown? Reduction of the tooth is required to create restorative space for the crown. Therefore, a crown should only be completed if there is an indication to do so. Otherwise, more conservative treatment could be considered to address the patient's concerns. If a crown is required to restore a tooth, there is no downside that would not occur without treatment, such as the development of dental cavities or tooth fracture. Minor discomfort can arise, such as tooth sensitivity, after the procedure. This usually resolves in a few weeks. On rare occasions, a crown tooth may require root canal treatment. In general, this occurs on teeth that are already significantly compromised and that would have likely required root canal treatment regardless. How much do dental crowns cost, and are they covered by insurance? Dental crown costs vary depending on the provider. At Vivid Prosthodontics, we specialize in crowns and offer our patients the highest quality restorations and the ability to customize the crowns with our in-house dental laboratory. This allows us to provide our patients with enhanced aesthetics and natural-looking results. Depending on your insurance plan, it is possible for crowns to be at least partially covered. Our office is more than happy to send a predetermination to your insurance company prior to completing treatment. Do dental crowns come with a warranty or guarantee? No medical procedure can be guaranteed due to the biological and environmental factors involved. In particular, a patient's own oral hygiene plays a significant role in determining the longevity of crowns. At Vivid Prosthodontics, we stand by our work and we use cutting-edge technology to ensure the best results possible. The value of seeing a prosthodontist that specializes in crowns is that you will have the confidence of knowing that your crown was done right the first time. Visit vividdental.ca for more information and to book your consultation today.